Good evening, everyone. Thank you all for joining us today. So we'll get started with the topic. The topic for today is it COVID or flu? You probably heard that COVID-19 and the flu share a lot of same symptoms, and maybe you're even feeling a little under the weather right now. So, how do you tell the difference between COVID-19 symptoms and flu symptoms? The short answer is it can be tricky, but we are here to help. Hello and welcome all. I'm Dr. Poonam Sharma, resident physician at Healthify Me, and I'll be your host today. In today's session, we will provide you an overview of both the viruses, the similarities, the differences between symptoms, when you should take care, and more. We have Dr. Anil Gupta with us today, who will be answering all your questions on COVID versus flu. Dr. Anil has over 45 years of experience in the field of medicine. He now practices on social media platforms for free on humanitarian basis. He has taken care of approx 600 COVID patients during the various phases of the pandemic with a motto of holistic care with minimal medications as possible. Welcome, Dr. Anil. We are glad to have you.
Hi, everybody. It's nice to be here to speak on a topic which is really bothering all of us and practically from the last 2 years. So it's my pleasure to be here.
Thank you. Thank you, Dr. Anil. Guys, we'll be answering some of the common questions and common myths on COVID versus flu to start with. That'll be going on for the first 25 to 30 minutes, after which you can drop in your questions and Dr. Anil will be answering that for you guys. So let's quickly start with how would people know if they have caught the flu or COVID-19? Dr. Anil, what's the difference between these two viruses?
Yeah, hi, once again. So it's a pretty tricky question because both of them present with similar symptoms. But out of experience and looking at the present state, we do come to know about it pretty quickly without even taking the lab tests in the preliminary phases. So first is, let me tell you about the similarities. The similarities are like fever coming on and off. It could be continuous. Then the nasal congestions, the nasal discharge, go down to your pharynx. You could have an itchy throat. You can have a painful throat, a lot of cough, or it could even present in other forms. It could be myalgia. By saying myalgia, I mean painful body, like your muscles are paining, you have a lower body ache, legs are paining. And in children, it can present in a different way. Like, you could have gastroenteritis, which can usually we see this in children. So these are the pretty common symptoms which overlap each other. But first of all, let's remember these two are very different and they're caused by different virus. COVID-19, as we know, is a novel coronavirus, which we all came to know about only in 2019, whereas influenza, or the flu, which we call, is known to us from a long number of years. Influenza can be based, let me just give you some basics. Like influenza can be caused by influenza A and B and C, usually. And whereas the COVID-19 is, as we know, it's a coronavirus. So, but let me tell you one thing. It is definitely there that corona is a much more severe than a simple flu. But having said that, a flu can also get complicated. Like it can go down into the lungs, cause you pneumonias, it can cause carditis, affecting your heart, but these are very small incidences. Whereas in corona, we have seen, especially in the first and the second phase, it was a terrible thing. Like it would definitely affect your lungs and other body parts. And we had people ranging from cardiac symptoms, respiratory symptoms, gastrointestinal systems. You can name it, we had it. So looking at how does a doctor differentiate between this and how does a common man also know something about it? A flu is usually short-lived. It can heal from 1 to 5 days. The incubation period, by saying incubation period, I mean the start of the disease and the showing out of the symptoms, is much shorter in an influenza, that is the common flu. whereas in a coronavirus is pretty long. It can range from as short as 2 days to go up to 12 to 14 days also. And then most of us also should be aware, right now
Hello?
we know about the corona. Can you hear me? All? Okay.
Yes, Dr.
There was some disturbance, so I just wanted to know that. So we all know that flu can be very seasonal, whereas corona is not behaving like that. It's coming in kind of cycles. We have seen already we are in the third wave. And of course, thank God, this third wave has been pretty okay compared to the first two waves. So these are the basically, I can only say that the differentiation will come in by lab testing. Once we go in for a classical golden test of corona is the RT-PCR. So the RT-PCR gives us a clear picture whether the patient is suffering from corona or not. And even in influenza, we do have common lab tests. So that also, this is a basic, and I can say the ultimate differentiating point. And the most common differentiating point is corona is more severe than flu.
Okay. Thank you, Dr. Anil. I mean, yes, it's been like pretty confusing for people because it seems like COVID, then it also seems like flu to
Yes.
them. And especially they're very confused with should they go for testing, because sometimes it's very common, right? They'll be like, no, it's just a flu. I don't need to get tested, but you can get tested irrespective of that. Like we need to ensure that we check in on our symptoms. Doctor, the next question would be, how does it spread? Is there any differences in the way it spreads, like be it the COVID or the flu?
See, basically, both of them are similar in spreading also. It's basically aerosol, like a person talks, a person coughs, sneezes, and a person who's pretty close to that person can get it. And that's why we always keep saying, keep distance, and wear your masks and all that. Though classically, the masks which we people use as a cloth mask really does not help. Let me be honest about it. It's only a C95 which can really give us the protection. Then there is the contact spread, which can happen when the virus with the droplets lands on some objects and you happen to touch the object and that hand of yours is infected already. And then you take it somewhere close to your face, your eyes, nose, and mouth. This can spread there. That's the reason we keep on telling, wash your hands, wash your hands, and wash your hands. I think that's pretty much required. And as far as possible, wear an N95. But the cloth mask is also helping us. I don't say it's not. It is helping us. And we cannot really advocate and ask everyone to do that. What is possible within the limits, we try. So that is the way. Basically, it is spreading by aerosol methods. That's why we say the 6 feet distance, the 2-meter distance, because the aerosol cannot travel. That's 2 meters and you getting infected. Hence, the best way is stay away from crowds as far as possible. That's the easiest way. And wash your hands, wear a mask. I think these have been told to us umpteen times by everybody. We hear the ads, we hear everywhere. And I'm sure all of us practically know this. Yeah, let's be careful as far as possible.
Okay. Dr. Anil, like wearing your mask, staying like making sure that you're not going to a crowded place as well, and ensuring that you are maintaining social distance is very important. The next question would be, Dr. Anil, who is at more risk? Like we know that everyone's at risk of be it COVID or flu, but are there any specific group of people who are more at risk, and how can they focus on their health in these times?
Yeah, that's a good question. See, what we have seen during the present times is usually the elders. By seeing elders, I can say senior citizens, anyone above 60, and having comorbidities. Now, these comorbidities could be simple diabetes, hypertension, immunosuppression by giving drugs. Suppose they're taking drugs for some transplant or some other autoimmune diseases. So these are the people who are more vulnerable. And so that is why I feel that they should take more precautions, in the sense trying to avoid again the same things, crowded places, try to be away from people as much as possible, take their medication and keep their diseases under control. So suppose you let diabetes run loose, you are definitely going to get it. So it's better that you follow your doctor's advice, keep your disease under control. I would say that is the key. Keep it under control. And once you get any symptom, be it as simple as a cold, as what they would call, visit your doctor or let your doctor know about it. So he would take further precautions and he would guide you further. I think being aware is the first thing. So elders should be aware of all these things and they should reach out to the doctor as soon as possible. Next is, we have seen surprisingly, this is low in children. Now, we really don't know because a lot of research is going on. They say the children are highly geared in their immunities because they face multiple viral attacks during their growth period. So we have noticed that it's less in children, and the intensity of the viremia is also pretty low in children, and they get out of it pretty quickly. But having said that, doesn't mean that let the children be loose. Make them also aware about it so that they are aware. And I see, in fact, most of the children are pretty aware now, and they are following a lot of protocols.
Okay, that's yeah, Dr. Anil Gupta. Next question would be how long someone can spread the virus? Like, yeah, being infected with the virus is one thing, but if it's a family, like it's very common that you have to like be in contact with them. But what is the period? Like, how long can people spread the virus? This can actually help everyone understand like when to step out or how long should they quarantine itself. So, what is the
Yes.
spread of the
So
virus?
usually we have noticed, since the incubation period is so different, it ranges from 2 to 12 days. And normally we have seen that people who can spread this virus is usually begins about 48 hours before the actual symptoms develop. Now, suppose there is a family living in a flat where the contact is much more than if they would live in a bigger bungalow where some people are living upstairs, some are living down. So I normally assume that when I get my first case, that others are definitely infected. So really, we cannot control this first part in a family. Now, that family should become aware and do not move out immediately. They should start quarantining themselves for the good of others. And of course, amongst themselves too. It's not a rule that all will get affected. So the person who shows the symptoms first should quarantine himself or herself, and the other members should follow the COVID protocols. So we have seen that in many flats too, only one person gets affected and others are symptom free. And now regarding the spreading, so they can begin spreading 2 days before without any symptoms. So he's gone into the market and come back. He doesn't know that he's going to get it, but he's already spreading it. And then when it comes to the actual symptoms, they can spread to as far as 6 to 7 days. So I would normally say right from the beginning of their first symptom, they could spread to as long as 10 days. Well, a lot of research is going on into this. We have seen cases who can spread up to 20 days, but those are not very common. So we cannot keep the whole community within walls for 20 days or 30 days, just because one or two could spread that. We are taking that chance, but the further the research is going to help us out in tabulating better things, and more protocols would be coming out, I'm sure.
Okay. Thanks, Dr. Anil. Dr. Anil, like speaking about differences on the symptoms itself right now, like of COVID, is there like any specific symptoms? Because we've been hearing that people with COVID are actually getting conjunctivitis. There are also some patients are also seeing skin rashes as well and gastric issues. Are there any, and the loss of smell and taste? So can you just throw some light on like Are
Okay,
these
let's
very?
let's just begin with the most. Let's begin with the most common ones. So the
Mhm.
most common one would be fever that comes on and off. In some cases, it rises pretty high, going to as high as 103 degrees Fahrenheit. It can go up to that high. Then they all of them have a nasal congestion, and then you have a sore throat. So they would call it that my throat is itching and things like that. But as we saw in our first phase, it would definitely affect the lower respiratory tract. By meaning lower respiratory tract, I mean the trachea, then it goes down to your windpipe, it divides and goes to your lungs. And it can even affect the alveoli, that is where the exchange of gases takes place. And the most critical part of the lung is that. That is why we were seeing a lot of HRCTs being done, and we used to have that glazed appearance on the CT scan. Whereas in influenza, you don't see. It could end up with a pneumonia at the most, and that too in a very little number of cases. Whereas in this case, we can see the classical symptoms, but it changed in two. It changed in three now. In three, we are looking at the affection only in the upper respiratory tract, that it could begin from your nose, your paranasal sinuses, which are all around your nose. It could go further down to your pharynx. By meaning pharynx is your, they say, gale mein dard ho raha hai. So it is that kind of a story. So the present symptoms are mainly being restricted to the upper respiratory tract, but it could present in very funny forms. It can present just as gastroenteritis, a severe headache, only a severe headache, nothing else. Then it can present with just myalgia. Myalgia meaning muscle pain. Mainly it is showing as lower back pain and pain in the legs. It could show as a mesenteric deficiency of the supply to the mesenterium. That means your basically your intestines are getting affected. It can come down as carditis, wherein your breathlessness, tachycardia, by meaning tachycardia is an increase in heart rate, can happen. So all these are symptoms which then the doctor gets alerted and immediate precautions are taken.
Okay. Okay. The next question, Dr. Anil, can be like, can the flu turn into COVID-19?
No, that's not possible. A flu is a different entity, a COVID is a different, but they can coexist.
Yeah.
Yes, but they cannot turn. One cannot turn to the other because the infecting organisms itself are different.
Okay. Yeah. I mean, and my next question would be like, is it possible to have COVID-19 and flu at the same time? Like,
It is possible in a way, though it's a very, very, very tricky thing, like, then you have to get into a lot of your research part. Then you have to do a lot of your lab tests and things like that. And uh, definitely a flu or an influenza would close much earlier. Like, within 3, 4 days, they're back to normal. But that wouldn't happen in a COVID case.
okay. Okay. And how do we diagnose? Like, usually symptoms are mild to moderate, and it's very rarely severe. Like, if there are severe cases, like people actually go to the hospital. But are there any home tests that people should be doing, or how would we diagnose COVID, or is it flu? And
Yeah. So let me tell you, see, at the beginning of this pandemic, we did have a lot of issues. Even to get a RT-PCR was like getting into a gold mine and finding your gold. A simple RT-PCR, which has become the classical test of today. So I would recommend you having symptoms for about 2 days. On the fourth or the fifth day, if the symptoms continue, please have a RT-PCR done. And probably what I've noticed is the government is being very proactive here. So you could just walk into any PHU public health center and get your test done free of cost. And since a lot of my patients are those who cannot afford to pay 1,500 for a home test, I recommend them to go to the public health centers and get their tests done. Because today, in a country like ours, we have to look at the cost factor in a very big way. So that is where I say, as far as possible, do your best.
okay. Yeah. I hope like all of us have been, all of us have got a clarity on when you need to get your test done. Doctor, the next question would be, how can we manage COVID-19 and flu at home? It's what is the management
Yeah, that's a good
for
question.
COVID-19 at home?
That's a good question. So let me tell you, I've handled more than 500 to 600 cases and got a fair idea as to what would be the best protocol to go about. So first you study your doctor. Of course, he's not daily in contact and examining him daily because we ourselves are scared, let me be honest. So we do a lot of telephone talks with them. And when we notice that the symptoms are mild, then I, for one, have started a simple method wherein I ask them to buy a pulse oximeter, buy a thermometer, and a blood pressure apparatus in case the patients are the elderly ones. Now, I give them a timing. I said at 8 a.m. in the morning, 1 p.m., 5 p.m., and 8 p.m. Give me these 4 recordings: your pulse, your oxygen saturation, your temperature, and blood pressure in the elderly. And at the same time, I give a strict advice. They have to continue with their medication, whatever they have been having before, and keep that as a primary one. And they have to then send these 4 readings to me at 8 p.m. And when on my WhatsApp, so I make a list. I have an Excel sheet now wherein I put the names, age, and things like that. And then we observe these 4 parameters. How are these parameters behaving? And that'll give us a very fair idea whether he's in the mild stage or whether he's in the moderate stage, or he's moving on to the next phase. If his oxygen saturations are dropping, his respiratory rates are increasing, pulse rates are increasing, the fever is not manageable, going right up to 103 and above that, then we definitely advise them hospitalization, especially in the elderly. Oxygen saturation is a good way of knowing things are going to be good or bad. Your respiratory rate and pulse rate and your blood pressure definitely follow. So when we are in the mild phase and in the mild to moderate phase, we manage them at home. The first principal thing is isolation. Now, we can't be very, very tough in isolation. For example, there are families who are having 2 rooms, there are 6 people there. So you got to be practical in your approach. So you tell them as far as possible, all of them wear your N95s. If you don't have N95s, you can't afford it, don't worry. At least get hold of a 3-layered mask or get hold of the surgical mask, which is the cheapest one available. You can get a good surgical mask for about 3 rupees. So we ask them all to use surgical masks at home. The person who's been affected so far remains in isolation. Of course, his food and other stuff is supplied to him. Then we tell the caretakers how to manage their washing their hands, wearing gloves, and all that little protocol is given to them. And of course, observation of this patient is the most important. And from there, we come to know whether he really needs any testing. That's the first step. Now, the testing, I would normally say, any test that we want to do, let's wait till day 7. Let's not start right away on day 3 and day 4. And, most of the tests will not show the results and it'll be just duplicating stuff. So again, I would say the finances also kick in here. I simply send them to a lab and again, repeatedly send them. It costs money. And as I told you, I'm dealing with a lot of poor patients. So I wouldn't want that to happen. Normally, I would send them to a lab on the 7th day, asking for some simple tests like a CBC. A CBC also will give us a lot of information. Then there are something called inflammatory markers. Now, these inflammatory markers can be very non-specific, and all of them are mostly non-specific. So I basically look, there are plenty, I can name about 20, but for the general public, I think 2 or 3 markers are more than enough. Like we could call CRP, that's a C-reactive protein, which is a common marker, but this would go up in any inflammatory disease. But it definitely helps us in marking and how COVID is behaving. And especially that is the time it tells us whether we are going to, what kind of treatment we are going to begin. Now, if I find a CRP high, then I definitely know that he's prone to some coagulation problems. He could get into a clot formation somewhere, and that can be very nasty. So that is where we begin with anticoagulants. And if other markers like your LDH or ferritin and things like that, if they are also on the higher side, like in stage 1 and stage 2, I mean phase 1 and phase 2, when we had our wave 1 and wave 2, that's why we started using steroids to cut down the inflammation and anticoagulants to see that no clot formation takes place in any part of the body. This clot formation could take place in any part and cause havoc. In a cardiac arrest can happen. If it goes to your brain, you'll get you can either get a hemorrhage, or it can get hemiplegia, or it can cause hemiparesis. It goes various things and numerous things. A clot can get dislodged and go to any place in the body. So this is where those anticoagulants did help us. And the steroids helped us in cutting down what we call was a cytokine storm. See, whenever there is an infection in the body fights it. But what was happening in phase 1 and phase 2 was the body was reacting abnormally to this. Like if X number of cells were to be produced to fight this disease, X number of cells, I mean antibodies, let's call it that. Huge amount of cells would be produced, which was not required to fight that. And that would fight the body itself. So the body itself would get into trouble. That is where we used to see severe respiratory distress. And the patient could be put on ventilators or oxygen in the first stage and goes on to the ventilators the next. This is because of the severe strain on the upper respiratory and the lower respiratory tract. So watching the patients is pretty critical. You should decide. Otherwise, it can be simply controlled with paracetamol. You don't require anything else in COVID. I mean, I'm one of those, when you study antivirals, say, a lot of antivirals are prescribed, right from small antiviral drugs to injectable ones like remdesivir and all that. But it has never proved itself. Even till today, nothing is proved because it's so new to us. I mean, it's going to take us more and more time to really find out whether an antiviral is working or not working. So we are at a very preliminary stage. But what happens is when the patient moves to the hospital and he's in a critical stage, then we have no choice. Then we start all kinds of antivirals. Then we even go to plasma transfusions. We have seen a lot of plasma transfusions, but there are varied views about it. And the number of tests, the amount of research done is in a very nascent phase. Like, is it going to really help? We see some patients getting out of it and we presume it has helped it. It could not have helped it. It might be just that the patient is getting better on its own. So these are all various research phases, which we will learn. For us also, it's a learning process. When COVID-19 came in, we hardly knew anything about it. But we today know fairly things about it or how it could behave.
Yeah, that was very informative, Dr. Anil, and I hope it was helpful to our users also. Just quickly, just a couple of more questions, Dr. Anil. What can you do to stay as healthy as possible? Like, be it COVID-like symptoms or be it if you have flu-like symptoms. Like, we've understood that medications and what your doctor advises, like taking care of your parameters, is important. Could you give us like some dietary advice or like physical activity? Like, people are confused. Like, do they need to start working out, or what can they do in terms of diet and activity if they have, be it COVID or flu-like symptoms?
Okay. Now, once you know that you have this, you practically come to know that second day, third day onwards. Do not panic. The first step, do not panic. It is treatable, and it's treatable by the body itself. The body itself is going to take over and treat. We as physicians are not doing a great job. Say, I made him okay. No, the body made him okay. His body responded. So stay normal as possible. It's very difficult. It's easy for me to talk and stay as normal as possible. But I would say, calm down. That's what I tell all my patients. First, calm down. Do what you're doing routinely, of course, in a confined manner. You cannot be going to the kitchen and cooking for everybody. No, I mean to say whatever you're doing, like say you're working, Do a little bit of work without stressing yourself. So your attention is diverted. You're not thinking all the time. And I would always tell them to do some breathing exercises, mild breathing, not that you severely start breathing there and get yourself into trouble. You do mild yoga, just to walk around a little in the same confinement of the room, do some writing, do some meditation, sit down and think about the good things of your life. Do not think about the bad things. All of us have good and bad. So think about the good ones. That's going to boost you up. And once your moods are better, your immunity improves and your fighting capability improves. Be positive. Positiveness is the key. Now, the second part is your food. Food can be as normal as possible. You have plenty of soups, you can have vegetables, you can drink plenty of water. Don't go in for junk food during this time. I would simply, especially the youngsters, would want a pizza to be delivered. They would want a pasta to be made. Well, it's okay sometimes, but I would say stick to your healthy eating habits. So a healthy mind, a healthy body, a healthy eating habit. This will keep you going. Write a small journal. Start writing what good things can happen. Contact your friends over the phone. Talk to them. Don't be alone and by yourself. Because that is where, those mild symptoms of depression, anxiety, nervousness set in. So at the initial phase itself, you can avoid them. So I tell all my patients, start communicating, talk to your friends, talk to everybody, talk to your brothers, sisters at home, talk to your mother, father, if they're away. That would keep you busy and doesn't give you that ideal time, which is a devil's workshop, all of us know. So that's the simple advice.
Yeah, I mean, like, yes, taking care of one's mental health, especially in times like
Yes.
this, is really important. And now
It's
that mental health is being spoken so much, Dr. Anil, could you just share some lights on what do you think
yes, yes.
mental health?
Now we are from the last it's 2 years now, almost. So now we are seeing cases which are called long COVID. Long COVID is nothing but a prolonged COVID, though it's not an infection anymore. He's not passing the virus to anybody, but the symptoms are there. Now, these symptoms could be as mild as a nose block, or it could be simple itchy throat, or it can be severe cough. Then it could be carditis. We have seen cases of heart problems, the lung issues. Then we are of late seeing a lot of cognitive dysfunctions. I hope I make it very simple by what I mean by saying cognitive dysfunctions. It is how you perceive things. See, cognitive functions would be your sensories, your brain, your memory, and how you would correlate in the present circumstance. We have seen breakdowns here too. We are seeing depression, we are seeing anxiety, we are seeing all this. So, this we are taking it up as a case to case, and the first advice of ours always stays, that is your exercises, keep your mental peace, be working, do not stop doing what you're doing. And one more thing I would like to add here is, especially, I think alcohol is not the right thing to be taken during all these phases. We are noticing that people who consume alcohol are getting into deeper trouble, or any substance abuse. Now, substance abuse can be very varied. It can range from a small pan, eating pan, to various drugs. Well, all these are a no, 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 no. You got to somehow get out of all this. Be a healthy, simple person in your life, who thinks positive. And I've noticed a lot of my patients who are positive, they come out of it with flying colors, I would say. They just as if, oh, everything is fine. And so these are the things which you have to definitely pay attention, and you have to approach the real, when you're feeling the problems are there, I think then you have to reach out for medical help. That's very important. Do not neglect it. Anybody with a palpitation, no, do not neglect it. Go and visit the cardiologist. Let him have a full cardiological evaluation to rule out whether you're having any problems or not. Suppose you're having severe lung issues, like, you're having breathing difficulties, though your oxygen saturation is showing pretty normal, anywhere ranging from 93 onwards. But still, I would recommend them to visit their doctor, find out what is the reason, whether it's anxiety causing that problem or there is a lesion which is causing the problem. So reach out for medical help when it crosses a certain threshold. You have to take medical help. And well, as I told you earlier, we are all learning. So long COVID, we are learning things and learning how to handle it. There are cases which I have seen have simple backache, nothing else. Pre-COVID, they were perfectly fine. Post-COVID, they're having backaches. So first, we initially try them out with basic things like your yoga, your stretching exercises, put them on mild anti-pain drugs. I wouldn't put them straight away on anti-inflammatories in a big way because of the potential damage that it can do to your kidneys. So my approach is holistic. Your mind should be fine, your body with your exercises, and your thought process should be positive. And minimal medication. Medication, by saying minimal medication, I would want all of them to follow only basic medication. And the basic medication is just paracetamol, nothing else. Nothing else is required. Unless, of course, you've reached a certain other phase where drugs are required, but not for a mild to mildly moderate, I'll put it that way. Those cases don't even require anything. They will recover on their own. And we are monitoring them, of course. It's not said that, oh, all of you will be fine and we leave them alone. No, monitoring is the key.
Yes, Dr. Anil, basically there are, and especially being Indians, there are a lot of times where you might get palpitations or you might be so stressed and anxious that people wake up, like I've been hearing from a lot of people that they're not able to sleep and they feel like they have palpitations, but it's not palpitation. So it's also in their mind because they're so worried about it, and like knowing about it and getting more clarity on what exactly could be wrong is something, and mental health is very important. Like speaking to a professional.
It's very true. Speaking to a professional kicks in here when they're having issues in sleeping, when they're having palpitations, though cardiac is normal. When you do the cardiac studies, they're normal. You do your pulmonary studies, it's normal. Your kidneys are normal. Your liver is normal. Now, then there is something where a professional mental health help is required. That is where they should either speak to other people. I would say first speak to your friends. Find out, the more you speak, the better you understand things. If that's not helping, you move to the next stage. You've already spoken to your doctor. Then you try to find some medical help in the form of psychologists initially and psychiatrists later. Because I think a good psychologist can solve 80% to 90% of the problems. It's only that 5 to 10% which require a psychiatric help. Otherwise, the psychological help is more than enough.
Okay, thanks, Dr. Anil. I think now we'll enable the chats, and all of you can put down your questions and I'll pick them one by one for you, and Dr. Anil will be answering it for us. So we'll just enable the chat right now. Just give me 2 seconds, Dr. Anil.
Yeah.
It's done, doctor.
Okay. So yes, everyone, you can start asking your questions related to COVID or flu, and if you want any help understanding how to manage it, we'll start answering it for you. So the first question is how to protect us from hospital crowds. That's
so you follow the first steps. You don't want to get into a hospital? Well, follow the first steps. Don't get into a crowded place. Don't go to parties. Don't party late at night. Come back home, eat normal food, healthy food. And that'll help you from even reaching a hospital. That is the first. But I'm just putting it in a very light vein. But if there are issues, then your doctor is the key here. He has to take the decision as to when you have to move to the hospital. Okay. But please follow the first 3. Be very positive. Eat good, healthy, stay away from crowds. And the usual protocols of COVID, wear a mask and things which have been told us was umpteen number of times. And I think it's getting into one ear and getting out of the other.
Yeah, Dr. Anil. And next question is how to control blood sugar levels in COVID? Like you have COVID
Yes,
and you are diabetic. How do you?
that's a good question. That's a good question. Now, normally what we are seeing is in diabetes, it worsens. The diabetes worsens. Now, this could be due to various reasons. It could be due to the virus itself or your psychological factors kicking in. You're worried and things like that. The more worried you are, the more blood pressure, though your more blood sugars will rise. That is a known fact. So you have to test more often. Like normally we do. See, it's very easy to tell us, okay, test 3 times a day, like you begin testing in the, nobody does it. So let us again come down to practicality. I would say during the COVID infection, at least check your sugar levels. One will be your fasting sugar level, a postprandial sugar level, and a random sugar level. If you keep these 3 levels within the normal, it is the best thing to do. That is if you're on oral antidiabetics. Now, suppose you could be on insulin. Now, in case of insulin, you have to adjust your doses accordingly. So the most important thing here is to keep your sugar levels at the pre-COVID levels or to the near normal levels. I can't say normal, at least to the near normal levels. So you should talk to your diabetologist in case required and adjust your doses. And having said that, the first part can begin with yourself. No, do not get into sugary stuff. Do not get into high carbohydrates, things like that. Avoid what all is possible from your side. Then go to the next phase of correcting your dosages. Then the third phase, if required, adjust your insulin level, insulin dosages. I think I've seen a lot of patients getting controlled with this without any issues developing. It definitely is going to go bad. Let me tell you that.
Okay. Yeah. I mean, please make sure that you're monitoring your blood sugar levels, taking your medication on time. The next question, Dr. Anil, is recovered from COVID, but headaches keep coming back. So
yes, this is what we call the post-COVID symptoms. And these post-COVID symptoms could be short-lived, they could be moderate, and they could be long-lived. Now, by being short-lived, they do have this headache coming on. We just put them on simple medicines again. Another case of, I think the Dolo 650 has become a house name, a household name. Even a small 3-year-old child knows Dolo 650. Now, this could help, but at the same time, we've got to observe them. See, a doctor plays a key role here. If the headache is there for 2, 3 days, 4 days, control them on these simple drugs. Do not even put them into anything other than paracetamol. I would say that. And if this prolongs, then we have to look as to why it's prolonging, though we know there is a background of having suffered from COVID. But we have seen, it's again a practical experience and a lot of research is going on. This normally disappears in 15 to 20 days with your, again, simple drugs. So please do not be overtly worried. But having said that, again, if it continues for an abnormal period of time, you have to seek the advice, again, a medical advice at a specific point, like you see a neurologist. Probably he will guide you better in telling you what this could be with a simple test and all that. If you can get worse, then we have all the other things following with an MRI and things like that. There is no end. So let us always go with a simple way of going ahead. There are headaches, they're going to be there. Wait for a reasonable period of time of 15 to 20 days. Then we start approaching it in a more scientific way.
Okay. Yes, Dr. Anil, that was very helpful because, even I've been hearing from a lot of people that there are very frequent headaches, there are palpitations, and when would that go? Like COVID was not enough, that there is long COVID also after that.
Yes. So we tell them 2 weeks. I simply say 2 weeks without even thinking. I say 2 more weeks, wait.
Next question, it's a pretty interesting question, Dr. Anil, how to know if I have an anxiety attack? Again, you have COVID and you're having, maybe during long COVID itself, you're having an anxiety attack. How would you differentiate between the either?
Yes, see, an anxiety attack, For a doctor, it's pretty simple. For us, it's very simple. For a patient, it might not be that simple. So when you notice a patient is behaving erratically, telling you it's paining here, it's paining there, and I have these palpitations, I have this headache going on, I can't concentrate, I can't do my work, you're seeing the beginnings of an anxiety problem. The first advice would be calm them down. Again, by talking. You don't need to put them on antidepressants or anti-anxiety agents at all. That's not a job. I would say that job is only a psychiatrist's job. That's not at all your job. As a doctor, your job is to speak to them, reinforce to them, put them in a positive phase, explain to them what an anxiety means and how to overcome the anxiety. There are very simple things to overcome anxiety. Put them on their routine work, whatever they were doing. Involve them in some play games. Involve them in talking sessions with others. Make them join a group where they talk to each other about things. These are the basic things. And especially in a home, it's the other members of the family which should play a great role. But nowadays, in nuclear families, and especially single families, a person is just alone at home. Now, those are very tricky. That is where your family doctor plays a very important role. He's the one who's going to do this talking instead of their friends and things like that, the family members. The doctor has to calm them down. He has to explain to them what are the anxiety symptoms, why they are there, how they can be overcome by simple techniques. And I would say yoga and meditation are one of the best. Or getting into a game, or play some quiz or do something. You keep yourself occupied. Otherwise, you're again 24/7 thinking about it. So these are the basic things you have to go about.
Yes, Dr. Anil, I hope the answer was helpful to the user.
Yeah. That's they tell them to calm down.
Yeah, reassurance is the key here. Doctor, next question, now that there is Omicron also there's Delta, and then there's COVID, there's flu, people are also having bacterial infections. How would someone tell the difference between Delta, COVID, or the Omicron itself? Is there any difference between both?
I would tell them don't bother about it. Simple. That's not your job. Just take it easy. You get well. Now, if you're going to start learning virology, then I'll give you a 2,000-page book. I'll send you the 2,000-page book. You can find out the difference. They don't need to bother. That's not their job. The only thing is they should know how it's behaving. Normally now we are seeing in Omicron cases, they're coming out pretty soon. In 6 to 7 days, they're back to normal. So that itself, now, for example, your RT-PCR is unable to tell you which strain it is. Now, to know the strain, then you have to do a genome sequencing. There is something called genome sequencing, which is done in high-end labs. Are you ready to pay that money and go and get this stuff done? For what knowledge? I don't think so. You know that you're a COVID. That's more important. Now, which strain of it is for statisticians? It's for the government to do that job, to know how many cases of this and how many, not for you. I think that very thing that you're suffering from COVID is more than enough. Deltas, whether it's Delta, again, subdivisions in the Delta. Tomorrow you'll have some other strain coming in. That's only going to spoil your brain. Even as, you know it, like virology. Virology is a subject which we read. But we don't come out professionally in that, in the sense, if you want to become a virologist, then it's something else. And that's not required for a common man. No, not at all. You'll be unnecessarily spoiling and getting into an anxiety phase. Don't get into it.
Yeah, that's very helpful, Dr. Anil. It's very important that whatever it is COVID, and just make sure that you're taking necessary precautions.
Correct. That's all.
Yeah. Another very interesting question, speaking about Dolo and paracetamol. So there's one person who's asking, shall we take paracetamol without doctor's advice? If so, how many days we can consume as a self-medication?
Okay. Now that's an pretty interesting question, which probably everybody should know. Now, let me tell you something about paracetamol. Your Dolo is nothing but paracetamol. Dolo is just a trade name, and paracetamol or acetaminophen in America. And this is what they call it Tylenol. They have different names for it. It's a pretty safe drug, first of all. But it can cause liver damage if it's taken in abnormally high doses. So that is why we tell them the safe dose for an adult, I would say begin from 18 onwards. Even if you take paracetamol 500 milligrams 6 times a day, that is every fourth hourly, it's pretty safe. But how long? That's the key. You don't keep popping up 6 tablets for 30 days. That's not right. Now, the 6 tablets for 2 to 3 days is okay. It's okay. Before we realize, otherwise they're having some other problems. So paracetamol is just your first phase of intervention, and if required to be prolonged for 5 to 6 days, or maybe 10 days max. We don't usually we have seen that we don't give it more than 10 days. It's a pretty safe drug. It's a pretty safe drug. And you can try this out the first day, but don't keep on trying it out every day.
Yeah, that's yeah. I hope that was helpful, Rizwan. Doctor, like just a couple of more questions, maybe just
All right.
we can try and wrap it because it's almost time, and we
No,
know
no
that.
issues. That's okay. Let's answer them.
Yeah. So the next question is like there's a lot of talks about these booster doses also, at least like for people who are elderly, the people. I mean, we are suggesting booster doses for them. So could you throw some light on the booster dose
Yes.
and necessary?
See, now what we are seeing now is the different strains coming in. Now, first, let me tell you about common flu. In flu, we have understood a lot. We know which are the major strains. So we take this flu shot every year. It has 4 strains vaccine. But about COVID, it's a little tricky. Even today, again, the research is going on. So we got our first shot, then we got our second shot, and now it's coming to booster doses. Whether, honestly speaking, is this booster dose helping? Is a very, very tricky question. I mean, I wouldn't be able to answer it in 100% certainty, but I can only say it will help. Now, why it'll help? This already the strain has changed. Now, is the same vaccine going to be helpful in this come in? Is it going to help here? Well, that answer is again, we are having a lot of gray area there. That 50 shades of gray kick in here. We have a lot of gray area coming in. But one thing is for sure, that when you get the booster dose, you're priming up your body. So your body is getting primed and ready. May not be specific to that particular strain. The strains are changing, but the vaccines are also changing now. They have also learned. The pharmaceutical companies are the ones who are the smartest. They are more smarter than anybody else because where the money is involved. So they are smarter. They are also getting into all this changing stuff. They see the new thing coming. So accordingly, the vaccine is modified. But for now, for a general public, I would say, please take it. The reason being, it's going to at least prime up your body to produce antibodies as and when required. And that's normally what we have been seeing and doing it. And we have all been seeing during this phase that the people who had been vaccinated twice, the severity of the infection was definitely lower in those. The number of deaths were hardly there. So that by logic, it is telling us that it's working. Though the research is going on, but there is something called logic which we have to attach everywhere. So it is working. So your booster dose, I feel, is required. And please go ahead and get it done.
Thanks, Dr. Anil. Yes, I hope everyone gets your vaccines and make sure you get everyone you love also get vaccinated. It's like all of us protecting
See,
each other.
there are a lot of anti-vaccinators also.
Yeah.
They say, no, vaccination should not be taken due to various reasons, maybe ethical, there's that, so many reasons, we cannot say. But, well, I personally would say take it.
Okay. Okay, Dr. Anil, just, one last question. So my mom, who's diabetic, has BP, thyroid, and has just completed her quarantine and came out of COVID. What are some of the things that that she should take care of for her mom?
Yeah. The first thing is take care of whatever you said. Take care of her blood pressure. Take care of her diabetes. Take care of her hypertension. Please keep them under control. You don't have to do anything more than that. Keep your basic problems under control. A healthy diet, again, exercise. Suppose it's an elderly lady, I would say walk 5 rounds. Walk about 3-4 kilometers or as much as possible. at least walk 1 kilometer. Do that and keep them active, keep them involved in something or the other. That's all.
Okay. Okay, Dr. Anil, just the one last question on people having sore throat, like irrespective of the 2 weeks passing and during COVID itself. So this sore throat is very common and very, very persistent also. So is there anything else apart from the betadine gargle, apart from the saltwater gargle? Is there anything else you could suggest for people who have sore throat?
I wouldn't say do anything more. Your saltwater gargling or your betadine gargling is more than enough. It will settle down on its own. So do not go into anti-inflammatory drugs. Why? I mean, again, if you're really feeling a little pain, your paracetamol is going to help. It's going to help to some degree, yes, but it cannot reduce the inflammation. The inflammation has to go down over its own period. The viremia has caused the inflammation. So your blood vessels are inflamed at the micro levels. They have to come down, and you cannot push it to come down. If you take an anti-inflammatory, probably the half-life of that particular drug will be there. Till then, the symptoms will be better, and the same symptoms start reappearing. And you cannot keep on having anti-inflammatory drugs endlessly. Yes, 1 or 2 days, put them on simple non-steroidal anti-inflammatory drugs. Put them on non-steroidal. Again, I would repeat that.
Okay. Yeah, Dr. Anil, I think there are more questions, but because like it's time's up right now, and with the rising cases of like be it Omicron viruses or the Delta virus and the flu posing like a double threat, and since COVID and flu symptoms overlapping quite often, it's best to isolate yourself as soon as you develop symptoms, start symptomatic treatment in consultation with your doctor. And looking at the current situation, it has become even more critical to follow the norms and get vaccinated. So
Exactly.
yeah, thank you all for joining us. Thank you, Dr. Anil. It was a pleasure having you. I wish you all a very good evening and take care. Goodbye.
Thank you. My last advice, stay healthy. That's all.
Yeah, very important. Okay, thank you, everyone.
Thank you.
Thank you, Mazio.